It's my very great pleasure to introduce to you Atul Gawande.
Thank you. In 1976, two philosophers, Samuel Gorvitz and Alasdair MacIntyre, wrote one of my favorite essays called The Nature of Human Fallibility. And in it, they pointed out that there were basically just two reasons why we would fail at doing anything that we might set out to do. One reason was ignorance. We have a limited understanding of the world and all of its physical laws that apply to it. But the second reason they called ineptitude, meaning the knowledge exists, but an individual or a group of individuals fail to apply it correctly. Now, to overcome ignorance, we've applied science. I would call it a particular kind of science, breakthrough science, and we've come through this last century with an extraordinary range of breakthroughs. For example, if you live in the developed world, we have advanced from a world where the majority of the world has to be farmers to one where we can feed an entire population with less than 2% of our population being farmers. We have reached a point where we have the knowledge to help you live, instead of on average in 1900, less than to your mid-40s, to where it's routine. You can expect you have a great chance to live past 80 years old and climbing. That kind of science of breakthrough has been how we overcame ignorance. But how do we overcome ineptitude? Or as I prefer to call it, just plain old failure to deliver without all the judgment applied to it. And the answer, I think, is incredibly important because we are at a pivot point in history. We are in a generation that is an unusual generation. For virtually the entire existence of humanity, our lives had been governed primarily by ignorance, meaning that the knowledge didn't exist to help us understand how we overcome our illnesses and disease and our lack of food and other conditions like that. By contrast, after this last century, we are in a place where ineptitude, the failure to deliver, is as important in governing lives as ignorance was. That is how far we have come. But then how do we overcome ineptitude? The key struggle has been complexity. In my field, in public health and in healthcare, for example, we came through this last century having discovered that the human body has 60,000 different ways it can go wrong. 60,000 different diagnoses and conditions that we have discovered in the last century. And in the second half of that last century, we have discovered 4,000 medical and surgical procedures and techniques, 6,000 drugs that can relieve your suffering, improve the quality of your life, and often cure the illnesses that you face. And so now our job has become to deploy that capability town by town to every person alive. I've said that this, I think, is humankind's most ambitious endeavor. And the way we can discover how to overcome ineptitude, discover how we overcome failure to delivery, is still science. But it's a science of delivery and systems. We have had some primitive thinking about how we create delivery. Our thinking about delivery is first we teach you. Here is what you should do. You should do X. You should raise your crops the following way. You should deliver babies the following way. You should wash your hands. And then we get very frustrated that you're not doing what you're supposed to do. We go to a second stage and we say, you must do this. We issue mandates and directives and incentives. And we get some advancement from that. But we are still frustrated because an awful lot doesn't change. And that's where we come to the third stage of modern development, which is to systematize what we're trying to accomplish, to make the way we deliver babies, or the way we raise food, or the way we wash our hands, the norm. And that means thinking about our systems that can be as simple as a checklist or as complex as different kinds of technologies. Now, we ended up launching a place called Ariadne Labs at Harvard and the Brigham and Women's Hospital as a place to try to find out how do we begin to create that kind of systematization in healthcare. Think about traffic, for example, how you got here. We have billions of people now on the roads, and yes, we've taught them how to drive their cars. And then when they don't do it that way, we enforce how they have to drive their cars. But the secret to the way we get around is the design of the roads and the design of the cars and some basic, very simple rules of the road, which allow billions of people to travel at extraordinary speeds and yet accomplish it with incredible safety. So what could be our rules of the road and the systems for our other areas of extraordinary complexity? At a place like we built, we're trying to find those points of leverage at every stage of human life, from birth to death. And I'll zero in on one core example, which is birth. Childbirth is still the major cause of death for the young and for women across large swaths of the world. And we've learned in the last century that there are 7 big killers, whether it is infection of the mom or infection of a baby. Asphyxia, 10% of babies are born not breathing. Prematurity, hemorrhage, obstructed labor, or hypertensive disease for the women. And we have known practices to address them all that have largely eliminated the likelihood that you would die from those conditions. But they are missing in a place like this, in northern India, at a typical birth center, in a state where neonates have a 5% likelihood of death. 1 in 20 die in or around the time of birth. And the reason why is those basic practices are missing. Hand washing, that critical step for prevention of infection, below 1%. Clean gloves, not available in 30% of deliveries. Or, I'll show you this picture. This is a baby 15 minutes after birth. And you can see the basics not having been dried with a clean cloth. No one watching. The most basic, not being warmed, the most powerful incubator there is putting the baby skin to skin to the mom. And then an unsterile clamp across the cord. This baby is alive, but just, and it does not surprise you, they have only a 1 in 20 chance. Now, in the work that we have done, we worked with the World Health Organization, who came to us, and we got an engineer out of the aviation world, out of Boeing, where we structured the most simple kind of system, just a checklist, in order to simplify and organize for the front line and for the managers of the birth center how to recognize gaps in care. And this is a checklist that brought those known practices, around 30 or so, together at critical moments. When the mother first comes into a birth center in labor, a second set of checks, just as the mother is starting to push to make sure you have everything ready and available that is required to take care of the baby, and the mom. And then in the first minutes after birth, the basic steps to resuscitate a baby if they're not breathing, or address and prevent bleeding from the mom. And then finally, before the mother and baby go home, the key steps that can happen along the way. Now, we carried out a trial where we were working with people at every stage of care. This trial was in North India, in the state of Uttar Pradesh, the largest state in India, 200 million people. It'd be the 5th largest country in the world. And in that state, we rolled out in about a third of the districts in 120 birth centers. Half of them we just observed, and in the other half, in a randomized trial, we carried out a quality coaching system for the whole team. This was aiming to provide some basic engagement, teaching, and then ultimately coaching, visiting at the bedside, side by side, working not only with the nurses, who are the primary ones who do the deliveries, but the doctors, the procurement clerk, and the managers at the highest level, giving them coaching and feedback and observation about where their gaps were on not following the basic steps of the checklist, and then offering a supportive hand for being able to solve those problems. Now, where we've gotten is that after 8 months of that coaching, including teaching champions who would carry on the quality work, we've now reached 160,000 deliveries, and just a couple months ago completed an evaluation of what happens. And what we found in the results was an extraordinary thing. First of all, if we could reach greater than 80% of the practices, you achieve a greater than 60% reduction in mortality. Now, the problems are, the control group was at 35% of delivering the practices, and they had no improvement over time, over the course of the several years of running the study. In the intervention group, we made incredible progress. You can see out of 18 practices we measured, you have a shift to the right. But the median improvement only got to 70%. On one level, that is an incredible amount of accomplishment in a very short amount of time to bring places that weren't washing hands to begin doing so, not treating the right kind of care for bleeding or for rescuing the baby. But on another, we also saw that only 13% got to that 80% goal. And in crisis situations, it was even lower. And yet, you could see the path. Here, at another birth center, this is 1 month after we completed the coaching, you could see the difference. The coaches come in and they offer, what do we want to work on where you're missing gaps in the care? And they said, first, can we clean this place? Yes. So let's have you learn to talk to your leadership about, let's bleach clean this delivery room. And you know what? We want privacy screens between the moms. Just some basic dignity, please. And then step by step, they began working on everything that was needed. This is a mom who came in by ambulance, her 3rd child. She, on arrival in the triage area, her water burst. So they brought her directly to the delivery room. And I give you the time clock here so you can see how fast things can happen. It's 1:57 in the afternoon. 3 minutes later, they've measured the blood pressure, which was done almost not at all in any of the birth centers. They checked the heart rate of the baby, which was perfect at 143, something again that was not being done. 8 minutes later, they had washed hands, put on gloves, done an examination, and found that the mother was fully dilated, her cervix was fully dilated, and she was ready to push. Next, they went, following down the checklist, checking all of the equipment, and seeing that they had a baby mask, sterile equipment, that everything was prepared as it should have been. At 2:12, 3 minutes later, one push, and this baby was out. You better be ready. Now, I want to tell you, I'm standing here, I'm watching this delivery, and the entire mood in that room changed. The nurse is looking at the community health worker that came with the mom, because that baby is not breathing. She's blue, she's floppy, and she's going to be one of that 1 in 20. But they knew now, they had the system in place to understand how to make it the norm that they do something. So right away, she has a clean cloth and she's drying the baby, and that's the first step for a child not breathing. You have to stimulate that baby and dry them, and that often gets them going. That didn't get her going. 30 seconds later, they have completely wiped her down and she is not breathing. After a minute of this not happening. She's made her way to the kit, grabbed the suction device. They don't have a mechanical suction, so it's a suction device you use with your mouth. And 25 seconds after that, she is suctioning out her nasal passageways and going down into the airway. The other nurse has gone to get the bag and mask to give that baby some fresh breaths. But this was enough. And I saw that baby start to breathe with just 2 minutes without a breath. 5 minutes later, he had a healthy, breathing baby crying on her mother's breast, warmed skin to skin, the mother reaching out and grabbing the hand of the nurse who could breathe easily now. This is what we can accomplish. We have sites now in 30 countries adopting this work, from single centers in places like Italy to the entire country of Namibia. But it is critical to do what we have not done when this happens. Invest in formal experimentation, data, and learning about the truth of the gaps and successes. What does it take to get to the 80% and 90% performance that makes that life happen? We have to do this well beyond birth and even beyond health. The values that we bring in health are the values that we all have. They are human decency. They are reason. They are a belief that we must be part of strengthening the community. And they are a belief that all lives have equal worth. Systems science and innovation is the next big opportunity to advance human well-being and health. But we've made a massive underinvestment. We are still stuck in the 20th century mentality that a breakthrough innovation is what we need, without understanding that we also need the follow-through innovations as well. We are a place that can change that. I checked back with this mother who delivered that baby. The baby's name is Anshika, and it means beautiful. Thank you.